The cure that time forgot. How would you like a therapy that had 70 years of history, had virtually no side effects, was inexpensive, had an efficacy rate of 60 to 80%, and a positive effect on over 60 diseases? Hi, I'm Tom Lau. I'm an inventor, entrepreneur, researcher, designer, marketer. I've worked in a lot of different companies, about 16 of them in the last 25 years. Had the privilege of about 5 years ago getting involved with this, ultraviolet blood irradiation. Worked with software design, put together 5,000-page interactive thing that was sold nationwide, and also the hospital preparedness for bioterrorism. It's another area that I worked at. About 5 years ago, I co-founded a health clinic in Michigan, specifically to see how ultraviolet blood irradiation did. In fact, it was a solo therapy. A lot of clinics, of course, have a lot of things, and we were able to use just this with some advertising, had doctor oversight, and did hundreds of patients. It really opened my eyes. I was a skeptic at first. I thought, how can light have that much effect? Well, now, after all these hours, I was able to spend almost 2 years investigating this 40 hours a week, researching, experimenting, 200 plus medical studies that are out there, designing and redesigning a new device that had the proper amount of joules of energy. Talked to hundreds of patients, and now I've been able to travel the country and talk with scores of doctors about UBI. We call it biophotonic therapy, and there's a reason for that. The word irradiation in ultraviolet tends to make people feel like there's an isotope or something, even though it's just light. So we use biophotonic therapy, a little more generic. But it could be called UBV, that's one out there, photooxidative therapy, photophoresis or extracorporeal photophoresis. And let me comment on that because Yale University worked on that 20 years ago. It was Edelson that actually took it and found that it could be very effective with T-cell lymphoma. In fact, they got it by the FDA, and it is approved for T-cell lymphoma using some of the same lights that we do. A little different therapy, but very interesting. There are about 200 centers around the world that use it. Johnson & Johnson bought it, and it's called Theracos. Some of the other names, hematological oxidative therapy, photoluminescence. So all those things describe the same thing. 1928, Emmett Knott was a scientist, and he was in Seattle, Washington, and he worked with ultraviolet blood irradiation, designed a machine. Now, he had designed the machine. He knew that UVC light kills bacteria and virus. Well, they had a woman who was dying of sepsis from an abortion, and was brought to him and said, do you want to try this? He withdrew some of the blood and was able to pass it by the UVC light, and lo and behold, miraculously, she recovered. And these guys are true scientists. They worked on animals, dogs, and other things during the next 5 years, but they took 5 years before they began to use it on humans again. 1939, George Miley, Georgetown University, doing thousands of treatments and wrote about it. In 1940, we have Henry Barnett had an excellent paper on 110 cases of UBI and the results of it. Robert Olney, Providence Hospital, Lincoln, Nebraska. He was a primary author who wrote many, many papers on UBI, and we have all those on the website. You can read them. 1949, Time magazine had an excellent article. They looked at acute rheumatic disease in 22 different children. They were aged 3 to 13. They were acutely ill with inflamed heart muscles, and they did UBI on them. They did about 3 treatments over a period of time, and they found out that, let me read it. The average number was less than 3. All patients left the hospital without a sign of rheumatic heart disease except mechanical damage that had already taken place in the heart. The conclusion, UBI is safe and may prove after further tests to be the best treatment available. 1949 Time magazine. Well, what happened? In the 50s, we got vaccines and antibiotics, and UBI was basically shelved. That enthusiasm just wiped out this kind of a treatment. In 1955 to 1990s, the Russians and the Germans picked this up, and there was a tremendous activity there. It still is. They have about 3,000 practitioners over in Europe using this. In the United States, we only have about 250 who actively use UBI. Now the procedure. In the past, we've taken whole blood, usually 150 to 200 cc's of whole blood, and taken it out, passed it by the light, and put it back in. Well, there's problems with that, and anyone who's done it understands that. You get a patient with hypercoagulation, and you've got this very thick blood. To get it out is one thing, to get it back in and reinfuse it's another. Well, what we did is we started experimenting, and we found now we can use 40 cc's, 30 to 40 cc's of blood withdrawn from the arm with a butterfly needle and a syringe. It's added then to saline and passed back, just like a lot of other IV therapies, back to the patient.
Very carefully, we will put the needle into the access port of the IV bag, and we'll slowly push the blood into the bag. Gently mix the blood and the saline together in the bag. And now we will roll open the clamp, and we'll want approximately 1.5 to 2 drops a second on our drip chamber as we allow the blood to return into the patient.
This therapy is very effective. I just wanted to comment. The American Cancer Society has even mentioned this on their webpage. They say ultraviolet blood irradiation treatment is approved, of course, like I mentioned, for T-cell lymphoma, but clinical trials, important, look promising for the treatment of immune system disorders such as MS, rheumatoid arthritis, lupus, rejection of transplanted organs, and graft versus host disease. That's right off the American Cancer Society's website. So we looked at this and said, let's see what happens when we dilute the blood. There's a study done in 1999 by Levinchenko, a Russian, and he was able to measure the different levels down in the blood to when the light was not being able to pass by, and he found that only 30 microns deep. That's only 5 blood cells tacked on top of one another. That's all the farther the light goes. 1 millimeter equals 1,000 microns. So in a cuvette that's 2 millimeters thick, just 2 millimeters, only 30 microns of the top level gets the light. 1,970 microns are actually in the dark. And that's maybe an analogy would be better. If we had a river that was 64 feet deep, how much would actually be getting the light? Well, only the top 1 foot. So you can see we were doing a lot of therapy. 97, 98, 99% of the blood never saw light. So what we did is we experimented. Let's take a look at this. Let's try 50% blood, 50% saline. 100% was absorbed. And then we went to 40% and 60 and 30 and 70 and 20 and 80. We had to get down all the way to 12% blood, 88% saline, and we still absorbed 99.9% of the light. Well, just to be on the safe side, we now recommend about 20% blood, 80% saline, and it is a fantastic therapy. Less clotting time, less nurse time, less chance of problems in the reinfusion. Blood gets more light because now it's mixed in with the saline. We only need 30 cc's instead of 200, no more evac bottles, less disposal costs. There are a couple things that I wanted to point out on the light. The old units used a 6-inch bulb. That 6-inch bulb, to get your full, what we call the power zone, you had to move past the electrodes. There's only about 2.5 inches, actually 70 millimeters of full power energy. We wanted more energy in because the new studies show that you need more joules of energy to go into the blood to really be effective. So what we did is we took the stock 12-inch lights and used those and got about 8.5 inches or 220 millimeters now of light. That power zone allowed us to get enough energy into the blood. Now the other thing that we looked at also was a larger cuvette, because the more surface area that you've got of light going in, the more that you're exposing the blood. Ours takes, actually, the one we use is 26 seconds of exposure going across, where many of the other units now only have 5 or 6 seconds. Penetration of the light into the blood is dependent on a number of factors: distance from the light source, light transmission of the blood, lamp length, cuvette length, flow and speed, absorption, penetration of the light. Turbulence is another issue that's ignored many times. To get that 500 to 1,000 joules of energy takes some design. Some of the other units out there just don't do that. The GHL 3000 is the one that we've seen produces enough energy to match the modern studies. I want to take a look at the three different bands of light. This is the visible spectrum of light, of course, we're used to, and this is the ultraviolet area. Now, UVC light is the one that has major cell inactivation. So at 254 nanometers, that's that band of light, we have virus and bacteria being killed the most powerfully with UV light. A lot of people didn't know there's UVB light and UVA. UVB light is used for graft versus host disease. Not a lot of the studies run that. It's a fairly narrow band. UVA light has quite a few studies, and it is best absorbed into the hemoglobin, almost twice as much as the UVC light. So if you've got a therapy that can combine UVC with UVA light, you're going to have a much more powerful therapy. In fact, I wrote a paper on A, B, and C, who's on first, some of the mysteries of UV light. You can read that. It's got 10, 12 different references, and you'll understand a little bit more on A, B, or C light. You're asking, too, what does this therapy actually do? Let's kind of divide it out here. I've already said it kills bacteria and virus, supercharges the immune system, kind of a shock. But one of the things it does is it improves circulation, microcirculation, and also oxygenates. They can measure up to 6 weeks later if someone has low oxygen and see the results of a UBI. Just an interesting story. We had a fellow come in, actually he was 94. His kids brought him in because he had dementia and didn't know their names, but he had sores all over his arms, and they said, can you do something for Dad here? So we did 3 therapies on him, and he went home. We didn't know what happened, but the kids told us later, for the first time in 9 months, he knew our names, recognized us, was getting in and out of the car by himself, he was in the bathroom by himself. Now that's that improved circulation and that oxygenation of tissues. I wouldn't say it's the first line for dementia, but it certainly had a great effect. Balancing effect, homeostasis, where we can take the immune system if it's low and bring it up, or if it's high and bring it down. Reduction of tissue pain. Obviously, when you get more oxygen into the tissues, it reduces the pain. Cardiovascular protection. Russia uses this a lot for their pre-op and their post-operative. It cuts infections. It helps the immune system. Anti-inflammatory effects, I might have mentioned earlier that it actually takes the products of inflammation from around what's called the near membrane coating of the erythrocytes, strips it off, and then allows it to gather more. Powerful anti-infection properties, stimulation of red blood cell production, and improvement in the flow and properties of the blood. If you take all those and boil them down, 2 basic actions. It kills bacteria and virus. It's got to be in the blood, of course. And then photonic energy is given and absorbed into the hemoglobin and then passed throughout the system, causing a homeostasis to occur. There's a lot of reports, over 200 on the website that you can go to. I want to give what one doctor had to say about this, Hep C, EBV, MS. Let's hear what he had to say. Recently, a case of EBV was dealt with in 2 sessions, a case of scleroderma, close to complete resolution. A colleague with early diagnosis of MS, cured in 2 sessions and doing well in almost 3 years of follow-up. He continued to write, other MS patients have experienced increased energy, less pain. One case of hepatitis C experienced return of strength and functioning well after 3 years. The more mundane things, but very successful, are things like herpes, Zoroaster simplex, idiopathic skin rashes, flu. Even HIV has viral loads that are dropped when they use UBI.
So I called the number on the bottom of the pamphlet and have had 4 treatments and am enjoying a much better quality of life.
I took this technology to Togo, West Africa about 1.5 years ago, and I encountered a patient there who appeared to be suffering from an acute rabies infection. There was no medicines currently at the missionary hospital that could help him, And I offered to treat him with biophotonic therapy. And after 3 treatments, he had a miraculous recovery and was discharged from the hospital later that week.
Early January, I couldn't walk more than about 100 feet without being completely out of breath. I was just about to get a handicap sticker for my car, and I got the first treatment here. And lo and behold, I had tremendous energy. I could start to walk.
I came in and received a UBI, and that night I was laying in bed and the side of my face just started really tingling and the pain went away. And after that I had no more pain with the shingles, and it healed up within, I would say, 3-4 days.
I had an awful pain in my legs. When I walked, I couldn't hardly make it. I was with my friend and I said, this is like a miracle. I can walk 3 miles and I don't even have to stop. And my daughter said, Mom, you're really looking good these days. She says, your eyes are so blue and I can do all the things that I always wanted to do without pain.
And then just one time, and then I was just gone. To me, it was like a miracle, you know, especially in her face and stuff.
I feel great. I feel very confident that my cancer is healing. Basically, I would recommend this therapy for anyone who has cancer of any type. There are no ill side effects.
Let me show too some of the studies and the efficacy of this. Now, I want to mention safety because that's important. Virtually there are no side effects with this. Little Herxheimer response if you have a bacterial or viral infection, but there have been over 1 million treatments. This is safer than aspirin. Let me mention, here's the efficacy. Some of the studies just show treatment of septicemia, reduced lethality almost 3 times. A very interesting study on peripheral vascular arterial occlusive disease was that they did a double-blind study, worked with 4 modalities, only UBI caused positive effect. And that had 3 times the walking distance that they could do before, just with UBI. 199 patients with peritonitis, reduced again lethality by 2 times. Pneumonia. Again, we see hospital stays are shortened, lethality reduced. Here's one with pyroinflammatory disease, reduced by 5 to 10 days, and the outcome improved and the number of complications decreased. And just a final one, pulmonary tuberculosis, 80 patients, goes through the study. In all cases, pressure moderately decreased, blood pressure decreased, a tendency for hypocoagulation declined, erythrocyte count and hemoglobin levels increased. What are the indications that this can be used on? Well, it's a non-specific, which is really great. This can be used in a plethora of different scenarios. Let's take a few of them. Cancer it's used for. It is a adjunctive for cancer. Of course, you're cutting the products of inflammation. You are increasing the immune system. You're increasing the blood flow. All very good things for cancer. But it is used more specifically viral and bacterial infections. So you could be doing HIV, hepatitis, herpes, mumps, polio, any of these things. Bacterial infections, the pneumonia, wound infections, severe acne even it's been used on, or E. coli, inflammation conditions, arthritis, bursitis, number of different issues that have inflammation, and most chronic disorders have some kind of inflammation issue going on. Circulation, of course, everything from varicose veins to claudication can be used. Autoimmune disorders, which I've already mentioned. So we have the fibromyalgia, lupus, rheumatoid arthritis, rashes, allergy, any of these things can be dealt with, even MS. And then a number of other conditions. It's great if someone has a wound that's not healing, or they even have they're looking at an amputation. This can save a foot, a finger, a hand. Yeast infections, tetanus. The last one I've got listed here is respiratory diseases, COPD, asthma, emphysema, sinus disorders, even tuberculosis. And the man who has worked with this, William Campbell Douglas, spent 10 years of his life perfecting this, and he put together a book, Into the Light. He had this to say about it. If you knew of a procedure that could save thousands, maybe millions, would you cover it up? It's unthinkable that what could be the best solution ever to stopping the world's killer diseases is being ignored, scorned, and rejected, but that's exactly what's happening right now. Just here in the United States, we've got a couple of doctors who are very well known. They both write newsletters. This is Frank Schallenberger. Frank said this about the new therapy and about the GHL. We dilute the blood, 1 part blood, 5 parts saline. It's a no-brainer to do. The stuff works fantastic. Since we've changed to this protocol, we've seen dramatic improvement in our patients. The GHL 3000 holds up well and is top of the line. We use it every day. And Robert Rowan, another well-known doctor, editor of the Second Opinion newsletter. I really like the absorption study. I think I can use it for training, but it makes the GHL 3000 machine the top of the line. With this information, he says, I think we can do almost as well as the Knott machine. The Knott machine was that old standard that came all the way through up into the 70s. It's antiquated. We can't use it anymore. I've heard there are a couple of them out there. Let's take a look at the machines right now. This is one that's on the market, been around for a while. It uses a single UVA bulb. It's reflectorized on the top, and the cuvette just slides into that area there. There's a number of complicating things with circuit boards and so on. Let's take a look at this one. This is the Umatron. It's been around for 30 years. It's pretty much the old standby. It's been the same pretty much. It's got 2 spots for bulbs in it, and it's been very effective in what's been used. This is GHL 3000. It has 3 bulbs of the longer 12 inches in. It has reflectorized on the top and the bottom. The cuvette actually is slid in here and drops right into the area of the bulbs. Good part about this is that you can change the therapy. This is the UVC light. Good for bacteria, virus. But if I wanted to change for the immune system, I would just slide this bulb in. Now I have a different emphasis of therapy. Still a UVC down on the bottom and 2 UVAs at the top. We look at the website. This has a tremendous amount of information for you. It is divided into categories so you can read about each specific, whether it's bacteria or viral or it's heart issues. So all the studies are there, but more than that, it's got the testimonies of patients. It's got the procedures, basics behind it, what to expect. It's all on one website. You can go there. It's drsubi.com. Now the big question, why isn't this used more widely? I mean, if it's that good, why doesn't everybody have it? Well, it dropped out of that mainstream acceptance, and it's not taught in the medical schools. It's into the integrative type doctor realm. There are skeptics, ignorance, they just don't know about it. They've never read the studies. It's a great challenge. Just go to the website, read the studies. The dollars aren't there like some of the drugs would be. This doesn't take a lot of drugs, a little bit of heparin, and it's not a long-term therapy. It works. The people who put this together too weren't business driven, and that's an issue. You know, it's important to get something spread out. And then the last thing, the FDA, although it's allowable in this country by the FDA, it's not FDA approved except for the T-cell lymphoma. So, in kind of a summary here, if you knew of an inexpensive, non-drug, proven therapy that's helped thousands of sufferers, would you use it? And frankly, I can tell you what happens. Would they tell a friend? And the answer is yes. Just want to end with the website again, www.drsubi.com. You're welcome to call me. My number, 517-202-5959. Again, or maybe easier, just to write me, info@drsubi.com.